Okay, ladies and gentlemen, this is our video lecture 1 for week 1, PHE 525. This lecture is an extremely important lecture as we are going to cover the selection of a program and a health issue. When choosing a health issue, you need to be cognizant of and remember what this course is all about. So what I've done here, ladies and gentlemen, I've given you the course description from the syllabus as well as the course outcomes, so you can understand specifically what we are looking for. Many make a mistake when they choose their topic and health issue in that they choose a program or an approach to the health issue which is clinical or research based in nature. We are not looking at research and we are not looking at clinical interventions. We are looking at interventions that are from the social and behavioral realm. So this course provides you with a foundation in the application of social and behavioral sciences to public health. There is another key: public health. The program cannot be a private or a pay-for program. It needs to be one that addresses public health and is available through a public health delivery system. Social and behavior theories are examined in terms of understanding health-related behavior and applying these theories to health promotion. And when we say promotion, we're talking promotion and prevention as part of the public health program. The course covers existing social inequalities and health status related to race, social class, and gender, and the critical intersection between social risk factors, behavioral risk factors, and the development and implementation of public health interventions. And again, when we say interventions, we're talking about health promotion and prevention through public health programs. The course outcomes are that you will analyze social and behavioral factors associated with increased risk of prevalent public health issues for informing development of appropriate programs or interventions. And the key here, ladies and gentlemen, is prevalent public health issues. Those public health issues that affect society and affect the everyday lives of individuals. Now, we do not limit this to a geographic region or say that you have to cover the entire United States. That's up to you. If you find a program at a county level that you think is exceptional and one worth reviewing, I would say that you need to be careful in choosing a program of that small or that micro of a program because of finding data and information supporting the successes of those programs may be difficult. You're going to evaluate the public health program's use of social and behavioral theoretical approaches and encouraging change and fostering community engagement in the public health strategies that are employed. You're going to assess public health programs for the extent which they consider social and behavioral factors in addressing public health issues. You're going to recommend appropriate strategies that consider social and behavioral risk factors for addressing the public health issue you've chosen. And you're going to analyze public health trends for identifying critical public health issues impacting communities. Now, I would suggest, ladies and gentlemen, that when you are looking at the issue for public health issue and public health trends, that you do choose a public health issue that is something that is prevalent in today's societies. For example, opioid addictions, public health programs to prevent the spread of STDs and HIV, AIDS. There are programs relevant to obesity, programs that are relevant to COPD and other heart diseases. So you're going to look for a public health program in the realm relative to the health issue that you are covering. The module objectives for Module 1 are to analyze a critical public health issue within your community or the community that you choose. Next is to determine social, cultural, and behavioral risk factors to evaluate in order to spark change. Chapters 1, 2, and 3 will key you into those various behavioral and social risks. Please make sure to read Chapter 1 of your textbook. For this particular unit, it is imperative that you are familiar with the myriad of cultural, social, and cognitive factors that a public health practitioner would use in order to assess, in order to implement programs that positively and successfully influence individual and population health. When you go to choose your program, the CDC website provided in the opening material for this unit, you go into Start Here and it'll have Module Overview. If you go into that section, you are going to see that Center for Disease Control and Prevention Division of Public Health website. I would also suggest to you the National Institute of Health also has some very solid websites and programs available to you. Module 1 is going to introduce you to the social and behavioral factors that public health practitioners must consider when developing a public health program. It explores the impact that behaviors have on health and the role of theory in health promotion to better understand how to challenge health behaviors. Scientists that work in a lab manipulate various factors and inputs into their scientific experiment. The public health practitioner lab is the world itself. It is the public. It is the communities. It is those areas in which they concentrate their promotion and prevention programs. The knowledge acquired in a social and behavioral sciences course is essential to the practice of public health. Regardless of what chosen public health career you go into, you will need to understand social and behavioral factors, and you will need to understand the theories necessary and implemented to change these behaviors. To improve public health, a practitioner must know the forces that drive people's behaviors and methods for changing harmful behaviors. Having this knowledge is critical for changing human harmful behaviors. Having this knowledge is critical for developing successful public health programs and interventions. And if we read further on into the overview, when we look at the obesity epidemic in the United States, there are many social, cultural, and environmental determinants of this public health issue. And they vary from society's role and view of the intervention into this particular issue. I would also suggest to you that many of the inner city issues relative to the availability of healthful foods would be an influence. And that could be a social and behavioral intervention that is used. If you choose a social intervention program, you want to make sure that you have enough data and enough discussion relative to the behaviors and determinants of that particular issue. And then inversely, those living in a rural area may have great food available, and it may be readily available in their immediate environment. However, they don't have the appropriate exercise facilities available, places to walk, places to remain active. They may also not have access to regular preventative and maintenance health care through a practitioner, as a primary care physician, for example. The list of determinants you will see can be limitless. They are indeed quite expansive when you look at the determinants. For purposes of your public health issue, you are going to probably want to focus in on a particular social environment or issue if you find that the general approach to that health problem is too broad. If you want to run by an idea on a public health issue, whether or not it is appropriate, please send me an email and I'll take a look at it and respond. Last but not least, this is a very important definition of behavioral and social science health. Behavioral and social sciences cover research from interpersonal mental processes to social and cultural constructs. We are not looking at lab research. We are looking specifically at research that is gathered from data, from observation, and from reporting environments through the CDC or the National Institute of Health. The core to all behavioral science and social research definitions is the study of mechanisms influencing behavior. As behavioral and social science research is integrated into the National Institutes of Health biomedical research, it will be harder for you to identify specifically that health problem or issue unless you do focus in on a particular issue and you address that issue from social and behavioral factors that can be contained and delineated for purposes of your project. With that in mind, we will take a quick look at the final rubric for the final project. You will note in the individual rubrics, you will not have necessarily the full information available for the final project, but you will build building stones or milestones. And when we look at the prompt where it says Roman numeral 1, those prompts are broken out individually for milestones. Please keep in mind that those prompts provide you the outline of all information that is necessary to be covered for each section of the milestones. So for milestone 1, the introduction and background, you are required to follow the prompt and provide all of the information in the prompt. Now I will warn you that the prompt for the final paper will vary from the prompts for the individual weekly milestones. You will, for the individual milestones, follow each prompt. For the final, you will have to do some rearrangement and restructuring of your final paper so that it qualifies for and meets all of the requirements in the rubrics. To give you an idea of the difference between a prompt and a rubric, because many students confuse the two, they must be read in conjunction. They do not linger out there as independent mechanisms, but they are combined mechanisms for you to follow to excel in your work. So if you answer all the questions in milestone 1 and you follow the prompts and you answer all of those questions, and this is not a worksheet where you answer as if you were answering a worksheet. This is a narrative. This is a research, project analysis, and recommendation. So you will not answer the questions as it were a question posed. You will answer it in a narrative analytic format. Then you turn to each unit. You will turn to the rubrics. And the rubrics will have exemplary, proficient, needs improvement, and not evident for the final project. You may at times find that you're not hitting the exemplary aspect of the rubric. And I will put in the comments portion of the track change documents I return to you what is necessary for you to get to that level of exemplary. I will also tell you to get to the level of exemplary, you have to meet the requirements of proficient and then go above and beyond. Most of the time what is required in above and beyond is a little extra effort relative to the examples and analysis, but in addition requires research and or specific examples to support your response. And that will take you between the difference of exemplary and proficient. Weekly milestones will be in weeks 2, 3, 5, and 7. And when I grade your milestone, what I will be doing is I will be doing track changes in Microsoft Word. You will receive that document back with track changes, but you will also receive comments within your specific journal rubric, or not journal, but milestone rubric. So you will have both a set of comments in the paper that is returned and the margin under comments, and you will have specific comments in the rubric. If at any time you don't understand how to and are having trouble accessing the paper for the track changes and comments, please let me know. I will tell you it is imperative that you adhere to and follow all of the information in the prompts and the rubric, and that you, once you have received the comments and track changes in the rubric, that when you've put together the final project or product, that you refer to those previous comments, because I do pay attention to what has been provided in previous documents, And when I review your final project, I will go back and ensure that you have made the improvements that are required and necessary. As you go through your documents, as you go through your assignments, as you conduct your research, you are welcome to send an email to me with any question you may have. And if you are specifically struggling with a topic or issue, I'll be more than happy to set up an appointment, and we can either meet by phone or through a online resource. My contact is p.vanash@snhu.edu, and my phone number is 801-940-2531. I wish each and every one of you a very prosperous and successful term, and that this helps you towards your final degree.